Hello, my name is Tamahene Benavidez. I'll be your nurse practitioner for today. And your name is?
Catherine.
Okay. I'll be doing a cardiovascular exam on you. Are you okay with that?
Yes.
Okay. Before we get started, I just want to know if you are in any pain or discomfort at this time. Do you have any cardiovascular history?
No.
Okay. What I'm going to do first off is I'm just going to be looking at your chest, inspecting it, both front and back, okay? It's symmetrical, both front and back. Chest expansion is equal bilaterally. Do you mind holding your arms up like so? Perfect. Checking out the front and the back. Symmetrical and arms straight out. Symmetrical front and back, and I'm just going to pinch your fingernails and checking for capillary refill. 2+, perfect. You can lower your arms, thank you. Now I'm going to take my stethoscope and I'll be listening for the 5 precordial areas. Okay. Using the diaphragm of the stethoscope, I'm going to listen to first the aortic for 10 seconds. The aortic is in the second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, left intercostal space, fourth intercostal space, left sternal border. And the mitral, which is the 5th intercostal space, mid-clavicular line. Then I'm going to turn the stethoscope over, listening to the same areas with the bell of the stethoscope. 10 seconds each. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Catherine, can you take a deep breath in and exhale? Okay, perfect. So I was listening. So when she exhaled, S1 was heard, and on inhalation, S2 was heard. Okay, go ahead and lay down for me. I'm gonna listen to the same areas with you laying down, okay? Are you still okay and comfortable?
Yes, I'm fine.
With the diaphragm of the stethoscope. 10 seconds, aortic, pulmonic, Erb's point, tricuspid, and the mitral. Then I'm flipping the stethoscope over, listening with the bell, aortic, pulmonic, Erb's point, tricuspid, and the mitral. Thank you, Catherine. Do you mind laying in your left lateral recumbent position, which is on your left side? Perfect. Using the diaphragm of the stethoscope, I'm listening to the same 5 precordial areas: aortic, pulmonic, Erb's point, tricuspid, and mitral. Flipping it over, same areas: aortic, pulmonic, Erb's point, Herbs point, tricuspid, and mitral. This point out, I'll be listening to make sure that S1 and S2 is heard. There's no abnormal sounds, no splitting. Okay, Catherine, do you mind laying on your back again for me? And just to recheck, are you still comfortable?
Yes.
Any discomfort or pain?
No.
Okay, so now I'll be palpating using my hand, which is just feeling with my hand the same 5 areas, checking for any thrills or heaves. Perfect. And there are none. While I'm here, I'll be palpating the point of maximal impulse, or PMI. Which is regular. No abnormalities felt. Now, Catherine, what I'll be doing is checking your pulses, okay? I'm just going to check one wrist right now, which is the radial pulse. And I'll check your pulses for 30 seconds, okay? Now I'm going to check both, just make sure they're symmetrical. These are the radial pulses. Rate and rhythm is regular with 2+ pulses. Now I'm going to go down to your femoral. Rate and rhythm is regular, 2+ pulses, again for 30 seconds. Popliteal. Rate and rhythm is regular, 2+ pulses. Posterior tibialis. Rate and rhythm is regular. And dorsalis pedis. Rate and rhythm is regular with 2+ pulses. I also want to address, when you have women who maybe are larger chested, instead of actually lifting their breast tissue for them, it may be more comfortable for the patient if you ask them if they can lift the breast tissue while you listen to their heart sounds, okay? There's also areas where heart sounds are heard best over. If you're trying to listen to, say, the S1 sounds, they're best heard over the apex or the mitral area. S2 sounds are best heard over the aortic area, while S3 and S4 sounds are best heard over the mitral left lateral decubitus position, okay? So this concludes the cardiovascular exam. Before we conclude again, Catherine, are you comfortable right now? Are you in any distress or pain?
No.
All right, do you have any questions for me? Thanks. Okay, thank you.